having the pager this morning?
Yep, I have it right here.
Okay, great. I know the clinic's really busy this morning, so I hope you'll get some pages.
Yeah.
I know that the providers could really use your help, but they get really overwhelmed, and
Yeah.
sometimes they forget to page, but I hope because I know you could be a big help to them.
Yeah,
that
I
you need
have
to
that.
talk with, so I'll be brief about this patient,
Okay.
but I'd like to tell you about him. His name is Mr. Thomas. He's 32. He's a male veteran. He's coming in for follow-up of persistent chronic headaches,
Okay.
and he carries a diagnosis of PTSD actually from his time when he was
Okay.
serving in Iraq. And one of the things I'm wondering about is whether the headaches, are related to all of that. And his PTSD seems pretty active.
Okay, so let's talk about some other possible causes, but you may want to refer him for treatment of the PTSD in any case.
So, do we know who does that? I mean, he might be a little bit reluctant, so I don't know. I don't know if we want to send him sort of in a wild goose chase.
Right. So, I mean, just refer him to the VA anyway, because they've got to have a program for that, I would think.
Yeah, that's true. He's coming in today for follow-up of his type 2 diabetes. By and large, it's been uncontrolled since diagnosis, and he has been given metformin for control and hasn't been very adherent to his treatment regimen.
Well, I mean, make sure he understands the importance of his medications. And you could always try motivational interviewing.
Yeah, you're right. And, I've had a little bit of training with it, but I really haven't done much of it since med school. Do we have anything to help out, like outlines or materials or anything?
Oh, it's easy. Just Google it.
So this is my last patient. This is Mrs. Muhammad, and she's 43, and she's here for a follow-up visit today. Unfortunately, her son recently died in a hiking accident, and
Oh my gosh.
she's so depressed that she can barely talk to me.
So where is she in the grieving process right now?
You
Would
know,
grief counseling be appropriate for her?
I think you're right. I think that she could really benefit from that, but she won't even open up to me at all today, and I doubt that I can get her to agree to going to see a therapist at this point right now.
I know that there's a dot phrase with the list of therapists. Why don't you try to give her that?
Yeah, since she's doesn't speak English, do you know if they have any translators?
I doubt it. But you can page the behavioral med consult service and ask.
Yeah, maybe. I'm not sure if they're available, but I'll try.